We are back with Dr. Ash Agarwala from Cone Health talking about hand and wrist wellness. We're continuing our conversation. So at what point, if people are having the numbness or the tingling or the pain, should they contact a specialist?
I think if it's starting to become more invasive in your day-to-day activities or really limiting you from doing things, people I think ignore this problem for too long to the point where I think they wish they'd come in and seen us sooner. So oftentimes, once people hear about the treatments and what's out there, a lot of times they'll kind of mention, oh, I've been dealing with this for probably longer than I should have.
Right. And so, the big thing is a lot of people would say, well, it's time to get surgery. And then so that scares a lot of people off treatment wise. But when is it time to consider surgery? And then what should they know about today's procedures?
Right. So, yeah, I think surgery is a scary thing. So coming in to see a surgeon can be an intimidating visit. I think the biggest thing about carpal tunnel is there's a lot of preventative things that we can try to help coach people on. So there's therapeutic exercises and stretching, things that we can show them. We can put them in touch with a hand therapist who can work with them a lot. There's injections that we can try, types of medications that can be utilized to try to alleviate symptoms. But then I think the biggest thing that we have now are these minimally invasive ways to relieve carpal tunnel surgically, one of them being endoscopic carpal tunnel. So that's something that's quite exciting, that's really allowing people to get back to their function and work a lot quicker, which I think was people's major hesitation in the first place, was thinking they were going to be out for weeks to months. The really nice part now is with endoscopic, we essentially just make a small little incision here beneath the palm, put a camera in underneath the wrist and release it from the inside out. The beauty of that is it allows people to regain and resume their function immediately. So there's really no time spent away from work or activities that's excessive. Sometimes there can be some soreness and things like that as you recover, but it's really, I think, opened the door for a lot of people to get this done in a lot more timely manner, so they don't have to make as much arrangements around it or plan around it as much.
Yeah, I can remember, like you said, it must have been like 15 or 20 years ago, people would be in a sling for like weeks at that,
Right.
and that's not the recovery time anymore. All right, let's talk prevention. What are some do's and don'ts for keeping our wrists healthy?
Yeah, so really avoiding, like we were mentioning earlier, this wrist bent or extended position. I think that's really a tough position for the wrist in general. But if you're starting to notice these symptoms and you find yourself in those positions a lot, that's really the thing you want to try to limit or reduce. That's going to help try to prevent this from worsening, because that's what it tends to do with time.
Okay. All right. And so then how important are posture and ergonomics in our everyday kind of life to make sure that we're protecting our wrists?
Yeah, I think the biggest thing, if you can find yourself, ergonomic positions for your wrists at a keyboard, or if you do a lot of work with your hands. I think people who use vibratory tools a lot, or things that are very kind of heavy grip type activities, if it's work or recreation, just trying to place your wrists in a more functional position, again, in that neutral type of position, so that you're not forcing the wrist to kind of be utilized in a way that it's not designed.
Okay. And so with that, in mind, are there stretches that you can show us that can help so that we can kind of ward all that off?
Yeah, so we call them sort of median nerve glides or tendon glides. So a lot of times we'll just show people simple things where you're stretching your wrist back slowly or stretching it down slowly, kind of working your fingers in these positions back and forth. And what you want to feel is more of a stretch type of motion, not feeling pain or creating more numbness. Those kind of things just done gently and repetitively throughout the course of the day, maybe while you're taking that 20-minute break from typing or something like that, can often alleviate this problem, so that as the day goes on, it's not getting worse and worse, because that's usually what people sort of describe.
Right, for sure. All right, so as we're wrapping all of this up, what final thoughts or advice for keeping our hands and wrists strong and pain-free for long-term wellness? Because that's what the key is, right? Long-term wellness.
Right. I think a couple of big things are, if this is progressing more, it's not responding to the easy things, come in and get seen. There's a lot of really good techniques out there to alleviate it. Carpal tunnel is a very fixable problem from a surgical standpoint, and we can really kind of restore people's function and activities very quickly. Another thing that I always like to mention to people, but I think is important, that if you've had carpal tunnel release done in the past, it doesn't mean that it can't recur. So I think a lot of people don't fully understand that if they've had it done maybe 10, 20, 30 years ago, and they're starting to notice the same symptoms again, this can come back. And so it's something that you don't want to necessarily ignore, even though you've had it done before.
Gotcha. Good points. All right. Thank you so much for your time and expertise. If you want to watch this interview again, maybe you need to send it to a friend or a family member. It's going to be in the To Your Well-Being section of our website.